Hello, my name is Dr. Doug Pooley. Welcome to stage 2 of living comfortably through COVID-19. What we're going to talk a little bit about today is health. What is the genesis of health and what does it mean to be healthy? If you look at the dictionary definitions, health is basically described as the absence of disease or injury. The World Health Organization gets a little bit better in stating that it is a state of physical, mental, and social well-being. I know for sure that the average guy, in fact, even the average healthcare practitioner, understands a lot of what disease is all about, but when questioned about what is health, often there's a problem. And let me give you an example. I have a patient named Carl, and I did a study for some other work that I've been doing about what people's opinions about health were. And when I asked Carl, he said, Doc, I have to tell you that I really don't think about it much because it scares me to do so. For the average person, health is kind of a black box of things. It's not being diseased, it's not being infirmed, it's being able to participate. Well, I have to tell you that from my perspective and the research that I've done, health is really something that for the most part we were all born with. Almost all of us were born healthy. It's the ability to thrive. It's the ability to participate. It's the ability to maintain independence to the end of days. It's really a comfortable existence that was our intended state throughout our lives and the lives of every other living thing in the world. One thing is for sure, though, is that once you start to lose health, it tends to be a domino effect. So if one system starts to break down, the rest break down. Now, the other day in the first video, I left you with a thought with regards to mobility and the importance of mobility to life and to health itself. Well, I want to expand upon this a little bit better and bring it home. Let's talk about the importance of activity and the immune system. In a recent article in the New York Times by Gretchen Reynolds, she points out that the research today is demonstrating conclusively that even one episode of exercise is enough to increase immune function substantially, and that the results of that carry on as a reverberation effect over a period of hours. When we look at the impact of exercise and immunity, to bring it home, let me quote Dr. James Turner, who was one of the lead authors in a recent study in 2018 on the importance of activity, exercise, and immunity. And he says that even when it applies to the coronavirus or COVID-19, he states unequivocally that to stay active and exercise itself is probably one of your best hedges in avoiding the infection. Now, exercise doesn't have to be vigorous to be effective. For example, Dr. Joan Vernikos, who was one of the primary NASA scientists looking at the impact of immobility upon health for astronauts, found out that just in the act of getting up from a seated to a standing position and starting activity creates a cascade of physiological effects within the body. And one of the most important affected is the immune system. So what I want you to take away from this is this. If you want to stay healthy through this, one of the things that you absolutely have to do is to get active. Now, if you're mobile, that means putting on those running shoes and getting out for 30 minutes, hopefully twice a day at least. Now, for those of us who are more housebound or compromised health-wise, just see fit to get up for 5 minutes every 2 hours during the course of your time awake. And that alone is going to stimulate that immune system and go a long way towards helping to hedge your bets. So right now, the best thing that you can do, get active to stay healthy. That's it for today. Now the next time, we're going to talk a little bit about the importance of diet and how that can impact your immune system. Be well, you guys. We're going to get through this. Thanks.